Welcome back to the Traders Network. I'm Michael Yorba, your host. Thanks for joining us. We are streaming to you from yorbamedia.com and broadcasting from the Dallas KFXR 1190 AM Clear Channel Studios. All right. It's my first guest on the show today, David Cantor, president of Vycor Medical. Its stock symbol is VYCO. Vycor is a medical device company, and it develops and markets unique innovative products that target a substantial unmet need. Now, the company's products are FDA-cleared, significant patent protection, over 55 patents, of which approximately 38 are granted and 17 are pending. Now, they operate through two distinct business units, Vycor Neurosurgical and NovaVision. David, welcome to the show. Please give us a brief description of these two business units.
Michael, thank you for having me. Can you hear me all right?
I can hear you great. And by the way, let everybody know we're patching you in from Italy today, right?
That is correct. Yes, that's right, Michael.
Welcome to the show. Tell us about your company and yourself. I'm the edge. I mean, I have the foresight to be able to look at your website and see what you guys are doing. You're really cutting edge technology. Fill us in. Tell us about it.
Yes. As you mentioned, Vycor Medical has two distinct businesses, both with significant patent protection and growth potential. Vycor Neurosurgical produces FDA-cleared next-generation brain access systems. So what does that actually mean?
Right.
Well, surgeons, when they operate on the brain to reach a tumor or the like, need to use retractor devices to facilitate the separation of the brain tissue and leave the surgeon with a passage for access. Our ViewSight Brain Access System, or VBAS for short, is such a device, but we believe much, much better than what's out there.
Tell us.
Vision.
Go ahead. Yeah, but in that it's better. But I read into it. Tell us why.
Sure. There's a number of reasons, but let me put our sort of product into context.
Sure, go right ahead.
As I mentioned, surgeons need to part the brain tissue to gain access to their target, commonly a tumor or something like that. Currently, what is a de facto standard of care is an instrument called a blade retractor.
Yep.
And just from its name, you can see the issue. The device is a metal spatula type instrument. The technology hasn't changed in over 50 years, which is incredible when one considers the advances in neurosurgery. The shape of the device is the issue. Its edges can cause excess pressure on the brain, particularly when the surgeon needs to go deep into the brain. There are 10% retractor-related injuries. Now, our VBAS device, to answer your question,
right,
on the other hand, is tubular, so it has no edges, and it's clear, which improves the visibility of the surroundings. It has numerous other advantages that I can go into, including it doesn't cause target shift, it's MRI compatible, etc., etc. So I know time is tight. It's been documented that its minimally invasive profile has allowed for procedures to take place that would have otherwise been considered inoperable. Now, this is a key point here. A few months back, it was actually reported in the papers that there was a bullet removal case, and the neurosurgeon removed 2 bullet fragments at the Lincoln Hospital, which he clearly stated he wouldn't have tried without the device. So our device actually saves lives. I think the important thing is it doesn't only save lives, but it also saves money. And how does it do that? It does it through reduced surgeon time. We estimate that between operating time and early patient discharge, those savings amount to up to $6,000 per procedure. Furthermore, the structure that I'm talking about, this tubular retractor we make, because it's made out of plastic, is rigid. And what that enables it to be image-guided compatible. And we are in the process of developing new image-guided systems that will be available later on this year.
Well, I understand that you can. This device that you have also allows surgeons to access parts of the brain for surgery that before now were inaccessible, and the patient was just doomed to either paralysis for the rest of their life or death. Is that correct?
That is correct. And it really comes down to its tubular structure. Our devices come in different sizes and in different lengths. What happens is in certain situations where the surgeon needs to go deep into the brain, the pressure caused on the edges of the blade retractors would cause too much hemorrhaging for a neurosurgeon to try and access that target site. Our devices have been used and have been documented in numerous studies, including papers in Cleveland Clinic and Johns Hopkins, that highlight this minimally invasive profile.
Give our audience a flavor for the pervasiveness of this type of device use. In other words, how many operations, procedures, just in round numbers, if you could, are currently where this product would be in demand for?
Yeah, and I'm sure this is an area of interest for all the investors on the call. According to the American Association of Neurosurgeons in the U.S., there's about 200,000 procedures annually that our device would be applicable for, with about another 130,000 identified through product extensions. On a worldwide basis, that would equate to a market potential for our device of about $700 million.
It's a huge potential. Now, when you say worldwide, you're already getting acceptance in other countries. Bring those out for us.
Yeah, international is now a big area of focus for us. So, we have regulatory approval in Europe, China, Japan, Korea, and Canada. And now we're really turning our attention to the large markets such as Russia and India as well.
Congratulations. It's groundbreaking stuff. All right, now I want to give time for the other product that you have. VBS sounds outstanding. Let's talk about NovaVision. Bring that out.
Yeah, if VBS story is exciting, I think the NovaVision opportunity is sort of mouth-watering. The aim of what we're trying to do with NovaVision is to become the gold standard for rehabilitation of vision loss from stroke. Our VRT, or vision restoration therapy, has been clinically proven to restore vision. Prior to VRT, there wasn't any other clinically supported therapy available to patients, unlike speech, physical, and occupational therapy that are quite common. In 2012, we acquired the only real competitor out there, Sight Science, and the numbers of potential patients is truly amazing. So what we're dealing with here, what we're talking about, is not patients, nothing to do with the eyes. We're talking about the eyes acting as conduits for visual information, which gets processed by the brain. And a staggering 30% of stroke patients suffer from some visual disability. So to put that into context, in America, there's 8 million people who have suffered a stroke. And every year, there's another 700,000, which puts our addressable market in the U.S. alone at above $1 billion, and a worldwide target of $8 billion. A staggering number.
It is tremendous. We've got about a minute, maybe a little bit less left, and there's no way we're going to cover all of the ground. But Neuro Eye Coach, real quick on that, and then I do want contact information for our audience to get to you.
Yes, of course. That's a topical subject. So we announced today the launch of another therapy, Neuro Eye Coach. It's targeted at a subset of patients, the same subset of patients as NovaVision. NovaVision addresses a slightly different market in terms of NovaVision actually restores lost vision, whereas Neuro Eye Coach trains patients to retrain them to make effective use of their eyes movements. Again, this is a very complementary therapy to the NovaVision VRT therapy. It's been designed by some of the leading professors in the space, Joseph Zeal at the Max Planck Institute in Germany, and Arash Sari who's the chair of vision at the University of Aberdeen. The therapy itself is supported by more than 4 decades of scientific findings, and for us, this is a significant milestone.
It is. This truly is the next big breakthrough. David, I want to thank you for coming on to the show. Let me double check. 1-800-205-8040 and neuroicoach.com for your website, and vycormedical.com for your other website. Is that correct?
Yeah, let me give you one other number. It's 1-888-205-0800.
0800.
I would urge anyone out there who has had a stroke and is having issues with a vision to contact us.
Right, and last but certainly not least, VYCO is the symbol. All right, David, thanks so much for coming on to the show. We'll talk to you very soon.
Michael, thank you, and thank you, listeners.
My pleasure. And a special thanks to Monk Media and 1-800-publicrelations.com for all their PR and media support. All right, coming up next, we're going to have Bill Soames, CEO and director of WaveSystems.com, another breakthrough company. We'll be right back.